Hello everyone, welcome to Raw Online. Today we will be discussing about medications management in bipolar affective disorder. I am Dr. Venkateshwaran, consultant psychiatrist, Chennai. So in this section, we will see what are the mood stabilizers available and what are the side effects, how do we have to monitor antipsychotic treatment, then treatment algorithm for bipolar affective disorder, rapid cycling, bipolar depression, and what the guideline says. We go into topic. First we will see lithium. Lithium has been one of the age-old treatment of bipolar affective disorder. It has been successful over years, and it is used in the treatment as well as prophylaxis of mania, and it is also used in the bipolar depression, and it is also used in the augmentation of unipolar depression. Even though there is no manic episode, lithium has been used as one of the augmentation strategies for depressive episode. Okay, lithium, it is level dependent. For treatment of mania, standard guidelines says the level should be 0.8 to 1 millimole per liter. Okay, so I am talking about acute treatment of mania. When you start a patient on lithium for acute mania, the level should be this. For maintenance, and once the symptoms settles, to maintain, to prevent relapse, the standard guideline says the level should be between 0.6 to 0.8. And as I was telling, in unipolar depression, for augmentation, the level should be around 0.6 to 1.2. One disadvantage of lithium is it has a narrow therapeutic index and it requires monitoring. So the blood levels are important in therapeutic effects as well as management of side effects. What are the adverse effects of lithium? Most common side effects include mild gastrointestinal upset, fine tremor. To overcome that, propranolol can be used along with lithium to reduce tremor. Polyuria and polydipsia, increase urination and water intake, and it can be mitigated by using lithium as in the night. So like it is common with twice daily dosing. So if you use lithium SR preparations in the night, once daily usage, the polyuria and polydipsia comes down. And skin condition, sometimes it may aggravate psoriasis and it can cause metallic taste in the mouth. Ankle edema and weight gain is one of the most common side effects of lithium. Then if you see long term, sometimes in some individuals it can reduce GFR, causing renal toxicity. And hypothyroidism is one of the common side effects, especially in the middle-aged women. The risk is up to 20%. 1 in 5 women has a risk of getting hypothyroid with lithium. But it can be supplemented with thyroxine. We need not worry too much about the hypothyroidism in lithium. And rare case of hyperthyroidism and hyperparathyroidism is also common with lithium. These are long-term side effects of lithium. Toxicity. Okay, when you start a patient on lithium and when the level goes above 1.5 millimole per liter, if you see, it will initially start with gastrointestinal side effects, increasing anorexia, nausea and diarrhea, and if it is untreated, it can go on to have CNS effects, muscle weakness, drowsiness and confusion, ataxia, increase in tremors. The fine tremors will become coarse tremors and muscle twitching. Okay, if any patient is on lithium, if you come across any gastrointestinal side effects or any CNS side effects, probably you should suspect lithium toxicity and do the level immediately. And if the level goes above 2 millimole per liter, then disorientation and sometimes it can lead to seizures, and if it is untreated, it can cause to progress to coma and death. And treatment, what are the treatment for toxicity? In more severe symptoms, forced alkaline diuresis to eliminate lithium from the body, but never use thiazide. Okay, thiazide can worsen lithium toxicity. Okay, you can use other diuretics for forced diuresis. If the level is above 3 millimole, then it requires urgent dialysis, where hemodialysis is preferred. In non-availability, peritoneal hemodialysis can be used. Okay, and this is very toxic and it has to be immediately addressed and it requires ICU care. And what are the risk factors for side effects? Any low salt diet, even it is dehydration due to any AGE or patient is on low salt diet, the lithium absorption increases and lead to lithium toxicity. Some drugs can interact with lithium, which we will see in the next slide. And physical illness like Addison disease, where there will be too much of loss of water and salt leading to lithium toxicity. Okay, these are the risk factors where we should be vigilant about lithium toxicity. And how do we initiate lithium? Okay, start in the smallest possible dose, 400 milligram light, and if it is elderly, start with 200. Okay, and monitor plasma level after 7 days. Then every 7 days till you reach the standard dose. Once the dose is reached, like you have to check for once in some guidelines say once in 3 months for a year and then 6 months then not. Some guidelines say every 6 months we have to monitor lithium level. Okay, pre-treatment workup with lithium, since it can cause renal abnormality, thyroid dysfunction, in vulnerable cases cardiac issues, and it is a teratogen, so we have to do these tests, RFT, TFT, ECG. If it is a childbearing age, we have to do urine pregnancy test. And once for monitoring, as I said, we have to repeat these things for first year once in 3 months as per some guidelines. When some guidelines say once in 6 months, we keep it as once in 6 months. We have to monitor these things. Discontinuation, start lithium only if you are planning to maintain patients at least for 2 to 3 years. If you start lithium for acute episode, if you are going to withdraw in 1 year, there is a chance of worsening of bipolar disorder. So, discontinuation preferably avoided if you start on lithium for first 3 years. Maintain on the standard dose of lithium, and then on gradually taper over 1 month. Okay, if you suddenly withdraw with the stop lithium, then that itself will worsen the course of bipolar disorder. So, discontinuation has to be very gradual, and maintenance treatment as per standard available literature, you at least maintain for 2 to 3 years.